I will talk about torticollis and a cause of torticollis that causes a very difficult and painful type of torticollis. Torticollis can be several things. It can be a fairly mild condition caused by being subjected to cold air from your air conditioning, or it can be the start of a flu. But it can also be a mechanical condition which is very painful. And to start with, I will talk about the anatomy of the neck. The upper neck, the atlas vertebra is the uppermost vertebra, and the atlas vertebra is responsible for about 50% of the rotational mobility of the neck, where it rotates upon the second vertebra, the axis. And below the axis, from the second vertebra down to the first thoracic vertebra, are joints with one intervertebral disc and 4 other joints. It's the ancovertebral joints and the zygapophyseal joints. And the interest in this matter is the zygapophyseal joints or facet joints. These are joints that stabilize the cervical spine and also guide the movements in the cervical spine. And those joints are about in this direction, leaning a little bit forward, and they are responsible for rotation and flexion, and to some extent lateral flexion, whereas lateral flexion in the cervical spine is a combination of rotation and flexion. And these zygapophyseal joints, they are synovial joints with a smooth joint surface, and they are surrounded by a joint capsule that stabilizes the joint and permits quite a large motion. And they are also equipped with a lot of nerves that gives information to the central nervous system about motions and tensions in the joint capsule and motions of the joints of the neck. And we use that information to keep our balance and to regulate motion and muscle tension in our locomotor system. And also in these joint capsules there are something that's called meniscoids. So that is a tiny triangular structure that surrounds the facet joint, and the use of these and the function of these meniscoids is that they increase the contact area of the joint, and it helps to stabilize the joint. So when we do motion, then the 2 joint surfaces glide on each other, and one glides a little bit above the other. So in that case, the meniscoid will give some extra surface area to the joint and increase the stability, which is very good. But there is one disadvantage with those little meniscoids, and that is if we do a complex combined motion with our necks, maybe we do rotation and extension, and at the same time we put some pressure on the neck, then we can come into a position where these small meniscoids can get stuck in between the joint surfaces. And this seems to be the case for most of the time. It happens at night when we roll around in bed, and sometimes we do strange motions with our head in bed, because most of my patients who seek help for torticollis tell me that they have went to bed in the evening in perfectly good condition and pain-free, and then they wake up the next morning with pain in their neck, and they can rotate the neck maybe a little bit to one side but not at all to the other, and they are in terrible pain. So what usually happens is, the theory is that some kind of motion at night has caused those meniscoids to get stuck in between the joint surfaces. And because the The joint capsule is equipped with a lot of nerves. The pain in the joint capsule will be very intense, and when the meniscoid gets stuck in that way, it also causes an inflammation. So when you have strong pain coming into the central nervous system from the neck, the reaction is to protect the neck, and that protection is by muscle spasm. So immediately when you get pain from the neck, the reaction is that the central nervous system just locks all the muscles in the neck and causes a painful muscle spasm. So in addition to the pain from the joint capsule, you now have also pain from muscle spasms in the neck. And that's a very painful condition, and it can be quite long lasting, quite different from the easier kinds of torticollis that usually eases up within a day. But this kind of torticollis can last for days, weeks, months, or even at worst years. I've met patients who's been unable to turn their head to one side for more than 2 years from this kind of condition. But there is a treatment for this problem, and that treatment is a chiropractic adjustment. So if you do a chiropractic adjustment that separates the joint surfaces, then these menisci can come into the right place and the pain will start to subside. The important thing is that the adjustment has to be done with very high velocity. The velocity of the adjustment has to be so high that it is quicker than the time that a nerve impulse travels from the joint into the spinal cord and back again to the muscles. Because if you want to do something with the joints, especially in this irritated condition, the muscle will resist any movement. But if you do the adjustment quick enough, then you are quicker than the nerve impulse and you can release the joint. And if the treatment is successful, then the meniscoid will come into its right place and the pain will start to decrease and the joint capsule will heal. Usually it gets much better already after the first treatment, and sometimes you may have to repeat the treatments, maybe do the treatment twice or even at worst 3 times before the joint is released.